Good evening once again. Welcome everybody.
Good evening, Dr. Chhabra.
Yeah, good evening.
Anand Mohan.
Well, Dr.
Hi.
Chhabra.
Good evening. Good evening.
Good evening, sir.
Hi, yeah, good evening.
All right. Good evening, sir.
Good evening.
Very good evening.
Firstly, I'll thank everybody for joining us. And right now, I also request everybody to keep themselves on mute. And we'll have questions being answered by sir during in few minutes, after a few minutes. All right. So good evening, everyone. Thank you so much for joining us. I'm Karishma Lamba, working with Indian Spinal Injury Center, and I'll be hosting the webinar today. Well, the lockdown has been lifted and we are all learning to live with the new normal. Before we got into COVID crisis, I'm sure we all had our own ways of working out, whether it was going to the gym, going for yoga classes, different kind of dance classes, swimming, etc. But now we spend most of our time at home, and working from home is a part of the new norm.
Yeah.
We sit in front of our computers or our laptops for more than 8 to 10 hours continuously, and we give very less time to our physical activities. What are the kind of challenges we might go through in the long run if we talk about taking care of our backs? So to discuss these crucial points and have a detailed insight, I would like to invite the expert, Dr. H S Chhabra, Chief of Spine Service and Medical Director at Indian Spinal Injury Center. Sir is also the president of Indian Spinal Cord Society, president of Association of Spine Surgeons of India, executive member Asian Spinal Cord Network, and International Group of Advancement in Spinal Science. He is also the advisory committee member for Stem Cell Expert Group of Indian Council of Medical Research, ICMR, Central Drugs Standard Control Organization, Institute of Physically Handicapped, IPH, Rehabilitation Council of India, RCI, Technical Advisory Group, TAG, Ministry of Social Justice and Empowerment. I welcome you, sir, and thank you so much for joining us.
Thank you, Karishma, for that nice introduction. Can you see my screen? I was trying to...
Yes, sir.
Yeah. So, I know that these are, we all know, in fact, that these have been difficult times due to the COVID-19 or the SARS-CoV-2 pandemic. And maybe around 5 months ago, we would have never dreamt that we would land ourselves in such a situation. And many of us may have seen the movie Contagion and have passed it off as a fiction, but lo, we are in the midst of it. We have a similar scenario here. Many of us would be forced to work from home during this pandemic, and as we work from home, we'll study how a number of back problems also creep in. And so in the next 20 minutes or so, I'll try to run you through what are the causes and how we can try to prevent these back problems. I'll start with a case of a 29-year software professional who had been having mild back pain off and on since 17 months. And then suddenly, after the lockdown since 3 months, there has been an exacerbation. He took some anti-inflammatories by himself and the pain subsided. Back pain again recurred after 17 days. This time he consulted a doctor who again prescribed him some medications and rest for 2 weeks. The pain subsided. But then again, the pain recurred after 2 weeks, right? He consulted another doctor who prescribed an injection in the back, then the pain subsided. But back pain has continued to bother him significantly. He has tried various remedies. He is very stressed because there is great pressure of work, but he can't put in his best. So can we try to imagine what went wrong in this software professional who has been bothered by back pain for the last 3 months, and he is not being able to work, and because of that his personal life is also under stress. Now, in order to have a good understanding of what went wrong, we need to have a broad idea about what back pain is, what are the causes, etc., and then we'll come to discuss about this particular case per se. I only want to mention that you're aware that amongst the commonest ailment that is there is common cold, right? All of us would have had it at some point of the lifetime or multiple times. But back pain is also almost equally as common. It is the second most common ailment after common cold, and it is responsible for the highest number of man hours lost in the industry in the US. 8 out of 10 of us would have a significant episode at some point of our lifetime, and nearly 70% of those who have the back pain will have a recurrence within 1 year. Generally, the young active age group is predisposed, even though it can be there in the elderly and the young as well. So in order to understand the principles of management of back pain, it's important also to understand the anatomy of the back. So we are aware that the back has a backbone within it, the vertebral column, where there are a series of 33 vertebrae, 7 in the neck or the cervical region, 12 in the mid-back or the thoracic region, 5 in the low back or the lumbar region, and then we have the sacral and the coccygeal vertebra, which are fused together. If you look at it from the side, it has a body of the vertebra in front, and then you have a ring-shaped bone which encloses a canal where the spinal cord lies, or lower down below the spinal cord the nerves lie. And then there are processes where the muscles are attached, this is the body in between, and then between two bodies there is a disc. Between two vertebrae there are joints, as you can see, which are called the facets. So a vertebra would make a couple of joints with the upper vertebra and a couple of joints with the lower vertebra. And so the vertebral column forms a protected passageway for the spinal cord and the nerves coming out of it at each level. And basically the spinal cord is a continuation of the brain. So they together form the central nervous system.
Right.
If you look at your backbone from the front, it should be straight, right? But if you look at it from the side, it has curves within it, forward curve in the neck, and then there is a backward curve in the mid back and the upper back, and the lower back there is a forward curve again. Forward curve we call as lordosis, backward curve as kyphosis, right? So as you can see here, the nerves coming down in the protected passageway, and each level the nerve comes out. So in the lower back, for example, the nerves go down to the leg, and from the neck the nerves supply the arm, and in the torso they supply the torso per se. Now, one very important thing about the anatomy is that the back is supported by the muscles, right? And they support the muscles and they move the spine also. And as man evolved from walking on 4 legs like the animals to walking on 2 legs, the basic change in the anatomy was not much, except that the muscles became strong enough to be able to lift man from 4 legs to 2. And then when we are on 2 legs, to support the weight of the upper part of the body. So with that understanding, coming to the causes of back pain, basically most of the back pains are mechanical back pain, but then you could have inflammatory back pain, and you could have more serious problems like infection or tumor also, which may cause back pain. When we talk about inflammatory back pain, we are talking about conditions like ankylosing spondylitis, which are like inflammatory pains like rheumatoid arthritis, where there are antibodies formed against the body's own joints, leading to destruction of the parts of the joint. So here it will differ from mechanical pain, which is a strain where which gets aggravated by physical exertion and movement and gets relieved by rest, and which could be due to just a muscle strain or due to a disc bulging back. And when it irritates the nerve, the pain may travel along the distribution of the nerve down to the leg or from the neck down to the arm. Or it may be mechanical causes, may be normal changes of aging like spondylitis, or when spondylitis increases and there is pressure on the nerve, then there are typical claudication symptoms. You will have pain traveling down the leg as you walk, and then after a while you will need to stop walking. You can't move any further. Then you rest for a while, even for a few minutes, and then you can walk the same distance. And this is typically known as claudication. And then there can be other conditions where the joints of the spine don't work well and one vertebra slips on the other. We call it spondylolisthesis. But coming back to the inflammatory causes, ankylosing spondylitis is one of the common ones. Here, you will be able to differentiate it from mechanical causes, since the pain will be more in the morning, along with stiffness, which will be there. So as the individual gets up, the back is very stiff, and individual is not able to move around freely. And as the individual moves around more, the stiffness reduces, and the back pain also reduces. So rest will increase the pain in inflammatory conditions, whereas it will relieve the pain in mechanical conditions. Just the contrary of mechanical pain, which is increased by exertion and relieved by rest. Now, amongst the infections in the spine, amongst the most common ones in countries like ours are tubercular infections of the spine, so port spine. There could be bacterial infections as well. There could be tumors in the spine, and some tumors like the multiple myeloma are quite common. Now, there are some predisposing factors which will predispose us to back pain per se, other than the causes. Even like a mild strain may precipitate a pain if we have predisposing factors. One of the most important is a sedentary lifestyle. If you consider lifestyle as it used to be 80 years ago, when men would work in the fields, look after animals, walk around, women would go to the wells, go to the field, look after animals, do all sorts of work at home. Exercises were inbuilt in the daily schedule, and muscles would get stronger. But nowadays, our lifestyles are far more sedentary, especially if we have a work schedule where we are sitting most of the while. So this predisposes, since the muscles become weak and then they don't support the back properly. So the other predisposing factor is bad posture, whether at work or at home. If we slouch in the chair or on the bed, if we work on the laptop in the bed, or not in a proper ergonomic condition, So the bad posture predisposes to strain because as you slouch on the chair or in the bed, or once you have a bad posture, the normal curves in the spine tend to get obliterated, right? If you slouch from the normal front curve in the lower back, it tends to revert to a straightened spine or a reverse curvature, which puts a lot of stress on the muscles and the ligaments, and that causes further strain and causes pain. So bad posture, then obesity, as the center of gravity shifts forwards, more strain comes onto the spine, and that predisposes to back pain. Indian women after pregnancy never do the exercises to again strengthen the muscles which have become slackened during pregnancy, and this often is the seed for long-term back pain subsequently. And it is very important that all women not only stay active during pregnancy, but immediately after pregnancy they start with some general conditioning exercises and some stretching exercise to build up on the back muscles. Now, stressful lifestyle is also a predisposing factor. You would say, what does that have to do with back pain? Pain is a very complex phenomenon, and anything, a lot of factors could trigger the pain. So if you are stressed, for example, then there are some chemicals secreted within the brain which lower your threshold to withstand pain. And pain, subclinical pain at any part may get manifest as the threshold reduces. So this is also a very important aspect. Now, if we were to try to analyze the cause in this software professional, or many of us who are there working from home during the lockdown, or even otherwise continue to be at home, what could have gone wrong, right? When people start working from home, they do not take enough care to look into the work ergonomics. So whether they sit on the bed or not on a proper height table with not a proper chair and work for long hours, that adds to the problem. And whenever you are at home and your lifestyle is sedentary, as it tends to become, then bad postures also tend to follow. Long hours in the bed or in the chair, you tend to slouch, and that puts a lot of stress again. And you are aware of the stress which has been there with all of us because of the uncertainties of the pandemic and the morbidity which is associated. So that causes a lot of stress, and then people working from home, there is the stress of working from a new environment which is always also there. So all of these contributed to pain in people and other back problems in people who are working from home or are confined to home during the pandemic. Now let's try to understand what happens when people get back pain. In fact, most episodes of back pain will last only a short time. 75% of them will recover in 3 months' time. But many of these will also have a recurrence. So it is important not only to be able to manage the pain during the time that it lasts, but reduce the chance of a recurrence of back pain. So what are the principles of management? Once the pain comes, we need to determine the cause of back pain. Here, a good history and a good examination supported by radiological evaluation is very important. And when it comes to radiological evaluation, you could do an X-ray where if there is a slip, spondylolisthesis or spondylitis, you should be able to find out. Or you may need a CT scan, or the doctor may advise an MRI if there is complications related to pressure on the nerve or on the spinal cord, or if the doctor suspects an infection or a tumor. This is an investigation to be done. And Sometimes if the doctor suspects that the bone quality may not be good, that is osteoporosis, which can also lead to metabolic back pain. There he may advise a DEXA scan, a bone density test, right? This is a vast topic by itself, but like India being the diabetes capital of the world, it is also turning out to be the osteoporosis capital in the world, with a lot of not only females but males predisposed to osteoporosis. And sometimes when the doctor suspects a tumor, may advise a bone scan or a PET scan. But the very important principle here is very important for all of us to understand that we never treat a radiological investigation. Right? Many attendants will come to us with an MRI and say, Dr. Saab, what is the treatment to be done? Or they will WhatsApp an MRI image and say, what's the treatment? No, unless it is something like a tumor or an infection, our management principle gets decided by the symptoms and by the evaluation rather than by the MRI. So very often we can do without an MRI, but we can't do without a good history taking and a good evaluation. So never treat a radiological investigation. Always you should tell in detail about your symptoms to the doctor so that the doctor can treat you accordingly. Now we talked about reducing the recurrence rate because that is so common, but also treat not only the pain, but treat the cause as well. So amongst the proven treatments, when we talk about proven, we call something that will change the natural course of the disease. And unproven are those which will not change the natural history of the disease. So spinal manipulation is an unproven treatment, heat is an unproven treatment, as is massage, ice packs, traction, corsets, and physiotherapy procedures like TENS, acupuncture, acupressure, epidural steroids per se. Now, amongst the proven treatments is surgery, but surgery is seldom required in back ailments, right? Only 1 to 3% of people who have back problems will ever require a surgery. So, if it is required, it gives wonderful results, but it is the first choice of treatment and it is not often required. They have found that a very important component is education of the person, and that's what we are doing today, right? Unless the individual understands what is the cause, and because one may be prone to back pain throughout life, so what are the precautions to be taken and how to prevent the recurrence? Unless they understand that well, they will not be able to comply with what the doctor has said. So this patient education forms a very important component. And aerobic physical conditioning exercises are a very important component of the proven treatments because they help in modifying the natural history of the disease. So amongst the physical conditioning exercises, aerobic conditioning exercises are walks, treadmill, aerobics, swimming, sports, dance, right? Anything which increases the oxygen consumption of the muscles and strengthens the endurance muscles. And these are more important than the stretching exercises that are there, which help to strengthen the muscles, also improve the posture, strengthen the bones. And here the stretching exercises, you could have resistive or stretching exercises, but these sometimes can increase the pain, so you should do only those which don't increase your pain per se, and do as much as doesn't increase. Don't go blindly by what the therapist says. If any movement increases your pain, you reduce that or stop that and start a different movement. That is true also for aerobic conditioning exercises. When you start gently and gradually build up, if you have not been doing that before, and gradually you will be able to build up and strengthen your muscles. So weight training exercises or resistive exercises, as we call them, they should be performed only after a clearance from the doctor, and you should not do that too strenuously to start with, and they are not as productive as the aerobic conditioning, which is the first choice, or the stretching exercise, which is the second choice. Now, we said treat the pain, but also treat the cause. So if it is a prolapsed intervertebral disc or lumbar canal stenosis or a spondylolisthesis or osteoporosis or inflammation or infection or tumor, we need to treat that as well. And then to reduce the chance of recurrence, we would remove the predisposing factors. Like in a sedentary lifestyle, we need to add general conditioning exercises. We could add stretching exercises. We should incorporate proper posture in our daily lifestyle. We should control any interfering psychosocial, professional, or personal emotional factors, right? Here it is important to understand that most of the back pains we can manage on our own. We can take some anti-inflammatories, or we can do some fomentation, apply some counter-irritant gels and control the pain and take long-term precautions as we discussed about. But there are some conditions where we should not take things in our own hands. We have to rush to the doctors. And generally we say these, when there are red flags, you need to immediately contact a doctor. And what are these conditions? It would be severe pain not responding to conservative treatment, or pain traveling down the leg or the arm, or if the pain is associated with fever, weight loss, neurological deficit, weakness, that is weakness in the legs, or difficulty in bowel or bladder control. These are absolute red flags. And in fact, we say there is all the indications for surgery in back problems are relative. That is, you have an option of a conservative treatment. There's only one absolute indication where you don't give an option and where you say surgery is mandatory. And that is cauda syndrome. That is involvement of the bowel and bladder control. The nerves which pass there also supply the bowel bladder, and in severe stress, they can be affected. Though this is very rare, less than 1% of cases, but it is possible. And one should be aware that in this case, one should immediately take the advice of a doctor. Now, there are many myths prevalent about back pain also. One of them is, if you get back pain, you need to be on bed rest. In fact, research has shown that it is counterproductive and you should be up and around as much as possible. Because if you are on the bed, the muscles become weaker, and we understood the importance of having strong muscles in reducing the back pain and especially reducing the recurrence of back pain. So this is a myth. You need prescription drugs to bring relief. No, most of these pains will resolve by themselves. You could even take over-the-counter medications, do some hot fomentation, apply some gel, take some therapy, and the pain is most often likely to go, except you should keep in mind the red flags. Stay away from surgery. This is also a myth. People say, नहीं हाथ मत लगवाना, स्पाइन को छुरी लगवा ली तो जिंदगी भर के लिए पैरालाइज हो जाएंगे, poor results होते हैं, high complication rates होते हैं. नहीं, when a surgery is needed, then not going through a surgery may have more devastating consequences, and surgery, spine surgery as such, is as safe as any surgery could be. But you have to get it done from a person who is seasoned with spine surgery. Amongst the other myths, don't exert yourself. You should never have restricted activities for, you should have restricted activities for life. It will not be a normal lifestyle. No, you can always get back to a normal lifestyle. You can get back to active sports, to bungee diving, to wrestling, to American football or whatever. So people have got back to professional, international level sports after major back problems. Now, when we try to analyze what went wrong, we analyze what could have been the possible for the causes in the software professional. But why did the pain keep coming back again and again? One of the main reasons was that the professional kept managing the pain, but not the cause, right? He was, the professional was never advised to try to look into the cause of back pain and to remove that predisposing factor so that the pain would not come back again and again, right? Often when we discussed as we work during the lockdown, work ergonomics are not given attention. So when people working from home should set up a proper workstation at home, it is as important as a good workstation in office, and that is often the key to preventing back problems. Bad postures, as we work from home, we talked about bad postures and our lifestyle becoming sedentary, the mental stress of pandemic we talked about. He was also advised a prolonged bed rest by the doctors, and he himself imposed bed rest on himself. So we need to look after the pain, but also reduce the chance of the recurrence. And it may be a lockdown or we may be outside of it, but even if there are restrictions, it doesn't prevent you from doing general conditioning exercises. It doesn't prevent you from using a treadmill. If you don't have a treadmill at home, it doesn't prevent you from walking around in the house for a stretch. If you build up on it, say, and walk 50 minutes so that the muscles stay strong. Of course, when you start with it, again, I'm telling that you start gently and gradually build up to that level. So it is important that you use some sort of exercise if you are at home or if there are restrictions. So, and especially important to have general conditioning exercises like walk, treadmill, cross trainer, stepper, etc. And maintaining a proper posture, doing some form of meditation so that we can take care of our stress and strain is also very important and helps us. So our message to this software professional would be all this, and I'm very sure that as the muscles gradually strengthen, as he improves on his posture, the chance of the recurrence of the pain will go down. But this doesn't happen overnight. You can manage the pain, but you won't be able to develop the muscles overnight. It may take 3 to 4 months for the recurrence rate to go down, but it will gradually go down. So when we talk about back ailments, some carry home messages. Back pain is the second most common ailment. Sedentary lifestyles and bad postures have been responsible for back pain reaching epidemic proportions, right? Second only to common cold. 75% of sufferers will improve by themselves within 3 months. And often it is we doctors who take the credit, but nature heals your back by itself. One should treat not only the pain, but also the cause and try to address any predisposing factors. So be aware about the red flags. If night pain, morning stiffness, pain radiating down the arm or the legs, difficulty in bowel and bladder control, straining for urine, passing urine, these are all red flags that you should be aware of. Only 1 to 3% of back problems ever require surgery, and proper lifestyle, including general conditioning exercises and proper posture, definitely helps in reducing the chance of the back pain. And if back pain has occurred, in reducing the chance of recurrence of back pain. So with that, I would want to thank you. Look after your back, and I'm very sure that you will have a happier life. And all these are nothing else but healthy living anyway, which we should anyway be doing. So if there are any questions, I'll be happy to address them. Karishma, I'm stopping sharing my screen. And will you direct the questions to me from? Or
yes, sir, I will. Yeah. Thank you so much, sir. Thank you. This was indeed very, very informative, and a lot of myths which you have cleared for a lot of people. A lot of people who are going through such problems also understand the technicality of few things which you explained very well. It's a very important subject right now when we are being at home. So we've had few online questions as well, and I wanted to ask you a few things which you've explained very well. But going back to the questions, in the post-COVID time, most of us are working from home. What are the common mistakes one can avoid to land up having a back pain?
Yep. We talked about that. I will, for the sake of reinforcement, because of the importance of the topic, I'll repeat. One of the most important things is don't maintain a sedentary lifestyle while at work, right? Incorporate some form of general conditioning exercise, whether it is walking within your room or treadmill or cross trainer or stepper. Any form of general conditioning exercise is not important only for preventing back pain. It is good for your heart. It is good for your metabolism. Name any part of the body, and this is like a wonder prescription, right? 50 minutes of walk, build it up to 50 minutes of walk at a stretch during the day, and keep most of the problems away from you. So then bad postures, right? We have to keep away from that,
Yes.
right? Try to have some form of meditation in your lifestyle, right? Now, for the sake of reinforcement, what is a good posture, right? Have a good quality chair. Don't sit on a sofa or an easy chair for long hours. In a good quality chair, the angle between the seat and back should be fixed around 100 to 110 degrees, right? Don't slouch in the chair when you sit. Take your buttocks right back to the backrest. If you are sitting for long hours, keep changing your posture every 40-50 minutes, right? If you're working on the computer, the monitor should be at eye level, right? Keep the keyboard generally on the attachment under the table or on the lap, right? If you have it on the table, then your arms will be stretched and that will predispose to neck pain. If you are on the bed, avoid slouching in the bed to watch TV or long hours. If you are very fond of watching TV from the bed, use a backrest which can go up. Now you have good beds which can be like hospital beds which can go up, right? Your mattress should not sag. In a standing posture, you should not be slouching. So a good posture, general conditioning
Can I please
exercises.
request everybody to keep yourself on mute? Sir is talking right now. If anybody has a questions, please write to us. We'll answer them one by one. But please, for now, keep yourself on mute. Thank
And
you.
again,
Sorry, sir, please continue.
mental health is as important as physical health. So meditate. Whenever you get stressed, you should count to yourself the advantages of being stressed, and then count to yourself the disadvantages of being stressed, and that will help you stay away from it, right? And Karishma, I see a lot of requests that if we can share the PPT. I believe this would be on the website and on the social media anyway for anybody to access. So please let people know how they can. Anyway, this PPT is there for your benefit. So we will ensure that all of you have easy access to it.
Yes.
Sir, can I use cycling, a sports cycle for my knees and a spine problem, sir?
Yeah, cycling is very good aerobic exercise. It helps the knees more than the back, but it is again an aerobic conditioning exercise. But when you start cycling, especially if you've not been doing it, ensure that you don't put too much resistance initially. And there are various ways to ensure that. One, if you have a cycle where you can adjust the resistance, keep it at zero resistance or a low resistance and gradually build it up. But if you don't have a sophisticated cycle, you can still adjust it. Initially, keep the seat of the cycle high. As you keep the seat of the cycle high, not much load will come on your knees. And with time, you can gradually reduce the height of the seat, and more stress will come on the knees. So a good exercise, cycling, good exercise for the knee, definitely.
So there's one question which somebody wants to know: Is yoga advisable with back pain?
Yeah. See, What we talked about stretching exercises is nothing else than yoga, right? Lying down on your back, lifting your leg, folding your leg, applying it to the stomach, folding both your knees, lifting your buttocks, lying down on your back, lifting one leg at a time. When you can, lift both legs, lift one arm and one leg at a time, right? Keep both hands on the side, lift your chest, lift both your legs and your chest together. All this is yoga only. But again, the golden principles of exercise, right? Start gently, gradually build it up. The first day, if you do intensely, you are sure to be on the bed for the next 4 days. Don't do any particular movement which increases your pain. If your therapist is getting you to do it, if you feel the pain during the exercise, ask the therapist to lower the intensity and lower the stretch per se. So less amount, raise it less often, gradually build up. So yoga is a very good exercise for back pain, but is not a substitute for general conditioning exercises. And evidence shows that general conditioning exercises like walks, treadmill, aerobics, swimming, sports, dance have a big role to play. So both can complement each other.
All right. So there's one more question somebody wants to know. They want to know, could you please inform whether back pain and neck pain are related? And the neck pain can later on also radiates to hand pain.
Yeah.
Hello.
So they are related in that the predisposing factors are the same, right? Your sedentary lifestyle, bad postures are common to both, right? Except that some, if you slouch on the table on a laptop for long hours, you are more predisposed to neck pain. So there are some postures which predispose to neck pain, some to back pain. But so they are related, right? And if you have a sedentary lifestyle, bad postures, you will be predisposed to either of them, right? Pain can radiate down the arm. As I said, pain can radiate down the leg. If there's a disc bulge in the neck and irritates the nerve, pain will travel down the arm. Like if there is a disc bulge in the back and irritates the nerve, pain can travel down the leg. So normally what you would be aware as sciatica in the leg, right? So this is nerve root irritation taking place, right? Some specific causes of neck pain, you would, when you go to the net and you will surf, you will, and type fibromyalgia, you'll come to know that there you have diffuse pain, many trigger areas in the neck, some pain traveling up to the arm, carrying on for years altogether. Medications give temporary relief, but very often if you go deep into it, people will be very stressed. They have a tense predisposition, and when you get stressed, the muscles in your neck go into a spasm. You can feel it there. And with chronic stress, the chronic spasm, there are trigger areas which build up in the upper back and in the neck, right? And these tend to bother you. So no amount of medications and therapy will help you unless you treat the cause, unless you manage the stress in this patient. So you often need, in most chronic back pain or neck pain, a multidisciplinary team approach of management, right? And that's how there are in many countries back schools, right? Where you can get all the disciplines to manage you together. So it is not only a doctor, it is not only a therapist along with it, a psychologist, right, who work together and help you come out of it. And then you may need an expert to counsel you on the ergonomics. If you have osteoporotic pain, you may need a dietitian to counsel you, right? You may need various specialists to look into. So very often a multidisciplinary team is required for chronic pain management.
Okay, thank you, sir. Thank you. So there's one more question coming up. Somebody wants to know about how to get rid of numbness.
Yeah, depends. One, we should know what is the cause of numbness, but we shouldn't be unduly frightened because of numbness also. Numbness may not necessarily herald the onset of paralysis as many people feel and get frightened.
Okay.
But numbness can be due to various causes, right? Numbness can be for the same reason as you develop weakness of the muscles in the legs or the arms due to irritation of the nerve. The sensory component, sensation component of the nerve getting affected can lead to numbness.
Okay.
But numbness can also be due to diseases like diabetes, right? Or other reasons leading to neuropathy. And by a detailed history, a doctor should be able to differentiate by the numbness due to various causes. But if he feels, he may advise you to get a nerve conduction study done to find out the exact cause. In our countries, one of the common causes of numbness is also a vitamin B12 deficiency, right? And that also would get revealed by a nerve conduction study if you get down once they find, they will do the investigation. So numbness, if it is persistent and is hindering your functions, you should see the advice of the doctor. Doctor will evaluate you and treat the specific cause of the numbness. Very often will prescribe you vitamin B12, Neurobion, as you are very often, you are aware of people take injections of Neurobion, etc. But trying to evaluate the cause and finding out that there is nothing sinister is also important. Most often, numbness is the last to resolve after pain. So don't worry if the numbness remains there for a while. It will not lead to major problems, especially if the doctor has said there is nothing serious.
All right. Sir, somebody also in that connection wants to ask if there is numbness in lower back. Is it a good idea to put a pillow or a towel roll or something on the side and then sleep? Anything in that context?
Not irrespective of the numbness, if there is a back pain, right? Then see, if you put a rolled towel or a small cushion or a small pillow in the small of your back, what it is doing is it is ensuring that the curve that we talked about, the forward curve, the lumbar lordosis,
yes,
that becomes maintained. When you lie down straight, there is, with the effect of gravity, and especially if you are obese, that curve tends to get flattened, right?
Okay.
And if your mattress is sagging, it will get flattened further. So if you have put a small roll of towel or a small pillow in the small of your back, either while sitting or while lying down, you are supporting that lordosis till such time that your muscles build up that curve properly and retain it, right? It helps you in that manner.
Okay.
And that's why also you will see many executive chairs in the lower back have a curve to the front to maintain that normal curvature of the spine.
So there was one more question about general food habits to avoid back-related problems.
See, if we were to describe in 2 words how you can try to reduce back problems, those 2 words are a healthy lifestyle. Nothing more than that. So whether we talked about general conditioning exercises, whether we talk about a good posture, all these are a healthy lifestyle, and it is equally, if not more important, to have healthy food habits. So nothing else than a balanced diet, and a balanced diet requirements may change with your age and with your problems. So a balanced diet for a growing child of 13 years, where he requires more protein, may be different. A balanced diet for a pregnant lady, where there are more supplements, more proteins required, may be different. A balanced diet for a perimenopausal woman would be different. A balanced diet post-menopause in an osteoporotic female will be different, right? A balanced diet in people with diabetes will be different. So you could find everything from the net, but it always helps to take professional help. You can easily get that online from dietitians, and dietitians should be able to mold a diet program as per your requirements and as per your health requirements. And that becomes very important.
All right. Thank you. Thank you, sir. So quickly, one more question. Going back to working from home, somebody is asking it. I sit in the in front of the system for almost 8 to 10 hours.
Right.
Is that dangerous for my back in the long run?
It is not dangerous. They say if you tend to get major shocks, then you make the foundation strong, right? So it will ensure that the house withstands the earthquake shocks as well, right? So similarly, it becomes all the more important if you have a work requirement to be seated for long hours in front of the computer. So you should be more cautious about the preventive measures that we talked about. Ensure enough general conditioning exercise in your lifestyle. Do some back exercises if it is possible, and maintain a good posture. So a good ergonomics while working. And I always say it is not possible to maintain a good posture on a computer, and least on a laptop, right?
Right.
But you have to have it as good as possible. So if you can avoid using a laptop, use a desktop, right? Have the monitor at eye level. Again, for the sake of reinforcement, I will repeat, monitor should be at eye level, keyboard on the attachment under the table or on your lap, right? And keep changing your posture every 40, 50 minutes, or during back pain, even earlier, 20, 30 minutes. But if at all you have to use a laptop, you could use one with a detachable screen so that you have the monitor at eye level and you can keep the keypad on the attachment under the table or on your lap.
Okay. Okay. Thank you, sir. Thank you. So one more question quickly. A lot of people are doing yoga and exercise classes online. Do you think it's safe for them to do it all by themselves?
See, the principles of exercises need to be followed, right? If you are healthy, right, and if you are not in the extremes of age, fine. But if you are elderly and have joint problems, it's always good to once get an evaluation done to be sure which movements you should be cautious about. Then if you follow the golden rules, gradually build up, start very gently, right? You choose a good teacher who is trained and experienced, right? Who should be aware that there are specific requirements, like one dress suits all is not the condition. You have to have a yogic exercise tailor-made for you. It can't be 100 people together doing the same exercise. So that needs to be tailor-made for you. If not, do only those movements which don't increase your pain. Start gently, whatever the yoga expert may say, gradually build up. And that is the mantra, to gradually build up with exercises without any problems, or with least problems.
Okay, right, absolutely.
And as we say, you may maintain your car very well, right? But some point of time, it will still need to go to the mechanic, right? So that you get back pain despite doing yoga doesn't mean that the yoga is the culprit, right? Maybe you would have had back pain more frequently and earlier if you had not been doing it, right? And it has deferred that, right? Or maybe sometimes enthusiastically you have overstretched and it causes pain, but if you were not doing it, the chances of you getting it would have been much more than if you are doing it.
Right. Absolutely. Makes absolute sense. So one last thing I would want to ask you, this is for all the people and all our patients who've been on the wheelchair. A lot of us, a lot of them have not been able to come to physiotherapy of late in the last 4 months because of the COVID crisis. Yet a lot of them are taking teleconsultation sessions as well. But anything you would want to suggest to them or guide them how to do their exercises, and something you would want to say to them also?
Yeah, I would want to say that our friends on the wheelchair, our colleagues on the wheelchair, need to take special precautions, and it is most appropriate that they don't move around and mingle and observe restrictions more stringently than able-bodied people. because they are more vulnerable to the pandemic and the complications than any of the able-bodied. The immunity in people with spinal injuries or those on the wheelchair is lower, and they can catch it more often. And due to specific requirements like the need to do intermittent catheterization periodically, and many of them may have pressure sores, so this acts as a source which may lead to infection per se. So take special precautions, don't move out, and only move out if it is necessary, right? So this is the first and most important thing. Second thing, I want to say that you can exercise as much from home as you can do that in a physiotherapy chamber. You could do it yourself after learning it, and because like you don't get somebody to feed you every day, no, you take it yourself, right? Some of our friends who have high tetraplegia, of course, that may be a factor, because this is to continue daily for lifelong. So similarly, whether it is yoga, whether it is general conditioning exercise, whether it is stretching exercise, this is not only when you have back pain or when you have a spinal problem. This is to continue for life. It is part of a healthy lifestyle. You don't actually need professionals to help you throughout. Only if you have problems or when you need to initiate it, you may take professional help, but you can incorporate it into your healthy lifestyle per se without any issues. So whether you are in a wheelchair, whether you are able-bodied, your requirements of the body for exercise is there, for a balanced diet, healthy food is there, for a good posture is there. Only that our friends on the wheelchair need to take special precautions till the pandemic resolves.
Right. Thank you, sir. Thank you so much for giving that insight for people on wheelchair as well. So quickly, one more thing I would like to ask you regarding hot fermentation to help for back health. It helps for back health?
Definitely. You see, you cannot generalize like the same that hot fermentation will help everybody. Generally, when the pain is very acute, in the initial 48 hours, ice packs may suit you better, right? But again, you can't generalize. Some people will benefit more from heat even during this condition, some with ice packs. So you have to see what suits you best. Some contrast bath may suit you better, but some form of therapy in the form of heat or ice or contrast bath tends to help everybody. And generally in the first 48 hours of an acute episode, it will be ice, and in the chronic period, it will be heat, which will help you better.
Okay.
And Karishma, I want to add, there may be more questions and we may not be able to answer all of them right now. If people write to you or to us or on the hospital email ID or on whichever way they approach us, we'll be happy to respond to their queries at any point of time.
Yes, sir. Yes, sir. Thank you very much for your time and your insight to all these important pointers. And yes, to all the people who are watching our webinar and the ones who are asking questions, we've tried to answer almost all of them. But in case if we still have left questions, please write to us on social media @isiconline.org. Thank you so much, sir. Thank you very, very much. Thank you for your time.
Last minute, Karishma.
Thank you so much, sir. Thank you very much.
Thank you, Dr. Chhabra, for
One
information.
very important message: stay safe. Always use a mask.
Yes.
Always use distancing, physical distancing, not social distancing in the true perspective, right? And good hygiene. And this is what will keep you away from the stigma, from the pandemic. So stay safe, stay healthy. Thank you for your kind attention.
Thank you.
We are always
Thank
there.
Dr. Chhabra.
Thank
Bye
you.
bye.
Thank you, Dr.
Thank
Chhabra.
you, doctor.
Thank you.
A host.
Thank you very much, sir.
Thank you very
Thank you
much.
for all the people who registered and are watching us. Thank you very much. I repeat once again, please write to us. I'm going to share the screen also for all you all to see the email ID.
Ma'am, can you please send the PPT?
Email ID, please.
Yes, yes.
You have sent the request for joining this webinar.
Thank you, Dr. Chhabra. Thank you, Dr. Chhabra.
Thank you.
Thank you.
Thank you.
So you can write to us on social media @isiconline.org. Please write to us over there and we will answer back all your questions. Thank you everyone for attending. Thank you so much, Dr. Chhabra.
Thank you.
Thank you.
Thank you, ma'am.
Liberty.
Dr. Chhabra, thanks to see you. Thanks for everything.
Thank you.